breast augmentation is a procedure where we place an implant, typically, behind the muscle, which is located behind the breast tissue to make the breast larger and to provide more fullness. A good candidate for a breast augmentation is a younger woman who has smaller breasts and wants larger breasts or more fullness. And the second group of patients are patients that have had one or more pregnancies and they've lost some breast volume and want to restore that volume. The third group are patients who have droopy breasts, which is usually associated with a loss of volume, and they're interested in having a breast lift, and we usually put in a breast implant in those patients in order to provide some fullness and some projection and help with the shape of the breast. Breast augmentation takes about an hour. An augmentation with a breast lift takes approximately 2 hours to 2.5 hours. Most patients who have a desk type of job, as an example, will have the surgery on a Wednesday or Thursday and typically go back to work on Monday. Most patients are about 80 or 90% recovered in that period of time. I usually have patients refrain from any strenuous activities for 2 weeks, and then they can start to resume exercise after that. So today there are 2 general types of implants available for patients having a breast augmentation: silicone gel implants, which are by far the most popular, and saline filled. The silicone gel implant has as its advantage, it looks and feels more natural than saline. It doesn't tend to wrinkle and ripple as much as saline, and today's most modern implants don't leak. You can actually cut a piece out of them and they stay together, so they'll last longer than saline. Some patients having a breast augmentation will opt not to have an implant, but to have the breast augmented with their own body fat, which is growing in popularity. In that situation, we perform liposuction on an area or areas of the body in order to harvest the fat, and then we transplant the fat to the breasts, which gives a very natural augmentation without using an implant for patients who have concerns about implants. It works very well. Patients are extremely happy after the surgery. They like the way they look in clothing, they like the way they look in a bathing suit, they feel better about themselves, it restores self-confidence. It's really a life-changing operation for some patients.